So in this video, let us try to understand what is anxiety and what are anxiolytic agents and the management of anxiety condition. So everyone you got exposed with the fear. So whenever the body got exposed with some life-threatening stimulus or events, immediately the person will get fear. So once a person got exposed with the fear, so lot of changes will happen in the body, like defensive behavior will be get activated in the body. Physically will be get activated to do the defensiveness. So then other than the main key role will be played from the autonomic nervous system. Activation of autonomic nervous system will happen. That's reflexly it will happen. Reflex stimulation of the autonomic nervous system, thereby noradrenaline may be get released. So fight and flight reaction it can show. And the person will become arousal. This is the change we can observe because he want to fight against the fear. Then other than alertness can be observed. Restlessness will be seen with the person. He will be very much alert. Stimulatory responses can be observed. Because of fear, such things will happen because it's one of the defensive mechanism. So then other than in the body, lot of changes will happen in the hormonal level. Corticosteroid secretion will rises and the person will go for the negative emotional thoughts. So this will happen in the normal individual when he got exposed with some of the life-threatening stimulus. But in anxiety, if you observe, so there won't be any stimulus. So the person will feel internally himself there's a fear, and unknowingly the activation of all the opposite symptoms or systems in the body will happen, so that it should be get treated. Otherwise, it may harm the patient. So normally day-to-day life, if you observe, the person will be get exposed to stress. Because of stress, some of the anxiety symptoms can be observed, but it won't be like the pathophysiologically explained anxiety. So that should be get distinguished early. Proper diagnosis should be made, and then only the treatment should be continued. Suppose if the patient is having anxiety. So now what is anxiety? So anxiety is an unpleasant complex combination of emotions. So now here negative emotions, or sometimes it may be restlessness. So we can observe it may be included with fear, oppression and worries. So here worries, like he won't be knowing like why he is worrying, what is the reason for worrying, but he will be keep on worrying. So such conditions are sometimes life threatening, also it should be get treated. So this commonly can be observed in the anxiety condition. So it's also accompanied by some of the physical sensations, so which may include palpitations, nausea, chest pain, or even shortness of breath. Even with the fear condition, so we will be coming across with changes in the physical sensation, but in anxiety it will be very much severe. So thereafter, like anxiety is often described to have cognitive, somatic, emotional, behavioral components. Coming with the cognitive, so it's concerned with the memory. A fear may be get generated, and so sometimes it may be get stored cognitiveness towards some of the activities what you will done. So then other than coming with the somatic components here, like some physical sensation can be observed whenever he get anxiety episodes, like palpitation, nausea, chest pain, or shortness of breath can be observed. Even negative emotional changes can be seen as a part of anxiety in a person, and behavioral changes can be observed. Similarly, in antipsychotic agents, we have seen like they are going to improve these behavioral components. So antipsychotic negative as well as the positive symptoms we have seen in the schizophrenia. Similarly, in anxiety also behavioral components can be observed. So let us see about the difference between anti-anxiety agents as well as antipsychotic agents, because some of the symptoms it may matches with psychosis also related to the behavioral aspects. But if you closely observe antipsychotics and anxiolytic agents, so these anxiolytic agents are resemble with the sedatives and hypnotics. As you know, some of the drugs under sedatives and hypnotics, for example, benzodiazepines, barbiturates. So anxiolytic agents resembles with sedatives and hypnotics in many of the pharmacological aspects. Let us try to compare antipsychotic agents with anxiolytic. So now antipsychotic agents have control over thought disorders, especially of schizophrenia, but anxiolytic agents, they don't have control over the thought disorders, because here also some of the behavioral changes will be observed, but anxiolytic agents, they do not have such action. Antipsychotic agent, very commonly they cause extrapyramidal side effect because they target is the dopaminergic system, but anxiolytic agents, they don't produce such things. But anxiolytic agents, they have anti-convergent property. That's why, like I told, like sedative hypnotic properties they resembles. Even so these agents, they produce a physical dependence, and even they may carry abuse liability, because many of the drugs acting on central nervous system, this is a common complication will come across of physical dependence. When coming with the last very important aspect to distinguish anxiolytic agents with antipsychotic agents, so they do not block condition avoid responses in the animals. Antipsychotic agents, they don't have this condition blockage response, whereas anxiolytic agents, like I told, like sedatives and hypnotic agents, because same benzodiazepines will come under the classification. So they block the condition avoid response. This is how we can differentiate anxiolytic agent with antipsychotic agents. So let us try to understand this condition avoid response. So now this in conditional avoid response in the animal experimentation, so we are going to give a hint before passing some of the panic stimulus to the animal. Say for example, you are going to press a buzzer, and so you are going to switch on a light in a pole climb apparatus, it's a chamber. After giving a hint of buzzer and light, you are going to induce shock to the animals. Repeatedly, if you are training the animal, so once you given the shock itself, it will come to know, like in the next step I will be getting shock, and it may try to escape from such events. So this is a condition avoidance will tell. The condition here, it comes because you have given a hint earlier. So now many of the agents, like sedatives and hypnotics, benzodiazepines, they have this property, even anxiolytic agents also. So they are going to block the condition avoid responses, but here anti-psychotic agents, so they are not going to block this. If you are given some sedatives and hypnotics, and if you are going to give hint to the animal also, it won't escape because of general CNS depressant. Whereas antipsychotic agents, if you are given and if you are given hint to the animal, so it will be okay, so that it will try to escape, that avoidance can be observed from the threat. So this is how we can differentiate it. Antipsychotic agents, they have condition avoidance responses. So let us see about the classification of drugs used in anxiety disorder. As I told, sedatives and hypnotics, even barbiturates have this property, but because of the side effects, and we have some better agents also, because nowadays barbiturates have got replaced with benzodiazepines. Similar properties they have, but benzodiazepines are safe because even acute toxicity happens also. So we have antidotes. In barbiturates we don't have antidotes, and the remaining property, it resembles with the barbiturates itself. So we have class of benzodiazepines. Example is diazepam, chlordiazepoxide, oxazepam, lorazepam, and alprazolam. And other potential anxiolytic agents we have in a class like azapriones, we have bisoprolol, and also we have antihistaminic agents, hydroxyl. So then other than we have beta blockers, propranolol or atenolol, because some of the associated symptoms we are coming across, like palpitations, such things can be overcome by giving propranolol, because stress induced it is. Many of the stress related actions will be mediated by adrenergic systems, which can be blocked by giving propranolol, so that we can overcome sweating, palpitation, associated symptoms of anxiety. So then other than we have carbamates. Meprobamate is an example for the drugs. So let us start with the first agents under the classification. So we have class of benzodiazepines. So already we came across with the drug in sedatives and hypnotics. A mechanism of action we came across of GABA receptor. These benzodiazepines are more commonly used drug which is prescribed as anti-anxiety agents also. Dose wise, they are going to show the action. Sedatives, hypnotics, anti-anxiety. Still a higher dose, so it may show some general anesthetic response also. This is popularly used because they have high effectiveness at dose levels, and they do not produce excessive drowsiness or physical dependence, because low dose of agents are used which can show some calming effect, that is the anti-anxiety effect. Coming towards the pharmacological actions, so they are going to show anti-anxiety effect. Even they have anti-convulsant effect also. Even skeletal muscle relaxation property they possess. Even hypnotic effect, cardiovascular system, so they are going to have some slight responses by changing the cardiovascular system. So then even they have analgesic action, but they are not used as analgesic agents. General CNS depression may be the reason for the analgesic response. Then coming towards the mechanism of action, as in anxiety, excitatory responses will be activated. So now here inhibitory responses or neurotransmitter levels should be raised in order to compensate the over enthusiasm or activation. So now GABA receptor activation may happen by giving the benzodiazepine. As we know, like in the benzodiazepine receptors, we have two sites here. One is the barbiturate binding site and other the benzodiazepine binding site. Other than we have different sets like steroid binding site and picrotoxin binding site. So now our target here is the benzodiazepine binding site. So once the drug you are given, so they will act on the benzodiazepine binding site, it's agonist binding sites. So now it makes the receptor get activated. Once the receptor get activated, more and more GABA will be get bounded on the agonist binding site. So once the GABA get bounded on the receptor, so now chloride ion channel will be get opened. So now why GABA got bounded here? Because receptor got activated. The reason for receptor activation is the drug. It will bound on the another side in the receptor, that is the benzodiazepine binding site. So thereby it opens the chloride channel because of more occupying of GABA on the GABA binding site, because it increases the affinity of the receptor towards the GABA. Once the chloride ion get released, so it causes hyperpolarization of the nerve. So now once the nerve is under excitation, so now such nerves will undergo hyperpolarization. Under hyperpolarized conditions, the nerve cannot respond for the new stimulus, because in anxiety, so repeated thoughts will be there, repeated thinking and lot of fear, such things and all, it stimulates the nerves. So now hyperpolarized nerve cannot respond for such thoughts or thinking. So thereby, so there won't be any activation of neurotransmitters and there won't be any responses. So that will be get blocked off. And on the other side, the calcium release also will be get blocked because of this GABA activation. Once the calcium won't be get released, so there won't be exocytosis phenomenon, such that calming effect can be observed. Let us see about some of the pharmacokinetic parameters and dosage of some of the selected benzodiazepines. As I told, like very low dose of drugs will be used here. We have many drugs as example under anti-anxiety by benzodiazepine class. Example is alprazolam. So daily dose 0.75 to 3 milligram it is used. Onset of action is very much fast, and peak plasma level 1 to 2 hours it will be get generated, and even the metabolites are also very active, and T half time is 12 to 15 hours it is. And we have next the chlordiazepoxide. The dose is 15 to 100 mg, and the onset of action is moderate, 0.5 to 4 hours peak plasma concentration is occurs, and metabolites is active here also, 5 to 30 hours it can show T half. And we have next drug, that is the diazepam. Daily dosage 4 milligram to 40 milligram. So onset of action by oral administration is very much fast, and peak plasma concentration will occur in half an hour to 1.5 hours. And active metabolites can be show some active responses here. Usually metabolism, after that we will be having both condition, like active or inactive, but here metabolites are active. T half is 20 to 50 hours.